Hello, my name is Vanessa Donaldson. I'm a second-year medical student at OSU College of Osteopathic Medicine. Today, I will be presenting our findings on the potential compounding nature of adverse childhood experiences and diabetes mellitus on maternal depression. My corresponding authors are student Dr. Hannah Vaughn, Dr. Caroline Markey, and Dr. Micah Hartwell. To begin, perinatal depression, PD, which is defined by the American College of Obstetrics and Gynecologists as a depressive episode during pregnancy and up to 1 year after giving birth, has significant implications. PD affects 10 to 20% of women in the United States and, unfortunately, is often overlooked and undertreated. A risk factor of perinatal depression is adverse childhood experiences, ACEs, which have also been linked to diabetes in adulthood. Approximately 35% of individuals with newly diagnosed diabetes mellitus are women of reproductive age, with overall trends of pre-pregnancy diabetes steadily increasing in the United States. Gestational diabetes, type 1 and type 2 significantly increases maternal and fetal risk. There is an increased risk of maternal hypertensive disorders, cesarean delivery, and increased risk of fetal death, birth defects, and preterm birth. Next, we look at ACEs, which are potentially traumatic events or aspects of the environment that can compromise an individual's sense of safety, stability, and bonding during childhood. ACEs have been associated with an increase of many chronic diseases in adulthood. Given the potential compounding impact of ACEs and diabetes on maternal depression, the objective of this study is to investigate the association between depression in pregnant women and diabetes status in the context of ACEs. For our methods section, we performed a cross-sectional analysis using data from the 2019 through 2022 Behavioral Risk Factor Surveillance System, also known as BRFIS, which is funded by the CDC. Respondents were included in the study if they were pregnant and answered questions about diabetes, depression, and ACEs. We used a logistic regression model to examine the interaction of ACEs and diabetes on diagnosis of depression among pregnant women. Table 1 contains the ACEs questionnaire administered to respondents of BRFIS. An answer of yes constitutes a positive ACE, and all responses were totaled to amount to a final ACE score. We have grouped individuals based on no ACEs, 1 to 3 ACEs, or 4+ ACEs. Results showed that compared to pregnant without diabetes or a history of ACEs, the likelihood for depression was significantly increased among women with a history of ACEs, which increased in a dose-response relationship. Women experiencing 4+ ACEs and having diabetes had the greatest risk of depression diagnosis. No significant difference in the rate of depression history was found in women with no ACEs having diabetes and was lower among those with gestational diabetes and no ACEs. In conclusion, we found a significantly increased risk for maternal depression in pregnant individuals with 4+ ACEs and diabetes, demonstrating a dose-response relationship. In light of these results, obstetricians and other maternal health care providers should obtain a thorough social history, including an ACEs questionnaire. Given the prevalence of perinatal depression, we recommend increasing access to mental health services for pregnant individuals with ACEs. Further, we recommend the promotion of protective and compensatory experiences during childhood to reduce the downstream effects of ACEs. We thank you for your time and attention and look forward to further discussion at OSU Research Day.